Does male circumcision reduce sexual satisfaction? Does it affect a woman's pleasure? From an evolutionary perspective, why did God create this piece of skin in the first place? Should it really be removed? Does circumcision protect against sexually transmitted infections? Do circumcised men have a lower risk of carrying HIV, HPV, and similar diseases? Who should perform circumcision, and at what age? Should it be done or not? There's a lot of confusion about this topic on social media. Circumcision ceremonies are another subject of debate. From a gender identity development perspective, does circumcision degrade girls while glorifying the penis? Does it grant superiority to men? Is it unfair to girls? We see countless discussions like these across different social groups. Even many veiled women criticize circumcision ceremonies, questioning their necessity and validity. Today, let's take a closer look at all these issues, one by one. First, circumcision has a religious aspect. Jews circumcise their male children on the 8th day after birth and organize special celebrations, meals, and gatherings. Some Christians also circumcise their male children. Muslims, following the recommendation of our beloved Prophet, circumcise their sons during childhood, before puberty. Now, let's move on to the medical aspect. What is circumcision? There is a fold of skin called the prepuce covering the head of the penis. In circumcision, part of this skin is removed. In an uncircumcised man, this tissue serves as a breeding ground for viruses and bacteria such as HIV, HPV, and other pathogens. These microbes attach to the cells in this area and multiply quickly. This increases the risk of penile cancer and makes it easier for these pathogens to spread to a woman's cervix, which is particularly vulnerable to HPV and cancer. For this reason, today, in many European countries, women do not want to have sexual intercourse with uncircumcised men. Now, circumcision does offer some protection against infections for adult men. However, this does not mean I can have sex with every woman, take no precautions, and nothing will be transmitted to me just because I am circumcised. This mindset is very wrong. To summarize medically, circumcised men have a lower risk of contracting sexually transmitted diseases and a reduced risk of transmitting them to women. However, in a life with multiple partners, this is not impossible. Even if you use a condom, you can still encounter HPV, as secretions can spread anywhere: your hands, your face, and any other part of your body. Warts may form, and the cancer risk exists for every individual. Therefore, the sole purpose of circumcision is not just to protect against contagious diseases. A colleague of mine once asked, "I've seen posts on social media, then why do people circumcise children? If it's meant to protect against infections when they grow older, why circumcise them as children?" Actually, here's why. When parents are not involved, no one really notices. When we spoke to many of our colleagues, we found that when young boys' circumcision is delayed until the age of 7, smegma accumulates behind the prepuce, causing it to become infected. The child constantly touches his genitals due to itching. Fathers often have to pull back the prepuce and wipe it with cotton each time. Fungal creams are applied repeatedly, and this continues until the child is circumcised. There is an age range for circumcision. We have a recommended age range. So, at what age is circumcision most appropriate for children, from a medical perspective? We suggest that it can be done as early as 1.5 years old, especially within the first few weeks, with local anesthesia, while the child is nursing from the mother and spending most of the time asleep. The care of the penis becomes much easier during this time, as the child frequently nurses from the mother. With the child's pain threshold and the development of the nervous system, this process is easier to go through. The mother is continuously holding the child, providing emotional nourishment, and it is easier to maintain hygiene since the child's bottom is exposed, preventing the spread of stool. Because the child isn't moving, healing is also easier. making the newborn period the ideal time for circumcision. However, if the newborn stage has passed, circumcision can still be done up until 1.5 years old. So, why do we avoid circumcision between the ages of 2 and 6 or 7? Because during the Oedipal stage, the child begins to become aware of their sexual organs and sexual identity. When the child's organ is touched or a procedure is performed, the child might think they are losing their sexual organ. It may seem to them like it's not just a small piece of skin being removed, but as though they are losing their entire organ. To prevent the child from thinking they are losing their sexual organ, we don't want the child to have any unnecessary contact with their genitals, anus, or other sensitive areas during the Oedipal stage and early childhood development period. Circumcision can also be performed after the age of 6 to 7. When a child who has not been circumcised by the age of 1.5 years has to wait until the age of 6 to 7, it leads to a continuous struggle with infections, the cleaning of smegma, and retracting the prepuce, which becomes a challenging process for both the parents and the child. Therefore, our beloved prophet recommended circumcision from birth and stated that it could be performed until the age of 6 to 7 before puberty. Generally, circumcision is done before puberty begins, that is, before the onset of genital and armpit hair growth, and at a stage where there is no interference with the child's private areas. The ideal age is between 6 to 9 years, before the child enters the developmental stage of puberty. This allows the child to experience the joy, excitement, and understanding of their male sexual identity in a healthy way, which we find to be medically beneficial.